Jessica DaMassa with WTF Health. I'm here at Health 2.0 and HIMSS in Europe, and joining me now I have Pascal Lardier. He is the editorial lead for Health 2.0 and HIMSS. So welcome, it's good to have you. The mastermind behind this dual conference.
Thank you, Jessica.
So talk to me about this conference. I mean, this is the first time this is happening together here, right?
Yes.
So tell me a little bit about the design. What were you looking for in terms of bringing speakers and bringing together the agenda for HIMSS and Health 2.0?
So first of all, we brought together the HIMSS and the Health 2.0 family about a few months ago. And at the time, it really made sense for us to have the two conferences under one roof.
Yeah.
We're talking about health innovation ecosystems, but they're actually pretty different. On the one side, we have a health ecosystem that has been developed that has grown around a core of hospital CIOs, CEOs, decision makers. And on the other hand, as you know, the Health 2.0 community has grown around a grassroots innovation movement. So what the startups were bringing to the market. And we really felt for a few years that the two worlds needed to, at some point, collide and start talking to each other. Because I think that nowadays people expect more from conferences than just, pretty keynotes about what the healthcare system is going to look like in 2050 or something like that. I think what they want at this stage of maturity of the market is to actually build some strong interactions between the buy side and the sell side. Because at some point we need to stop bringing new ideas, new technologies, and we need, yes, exactly. So this is really our aim, bringing these two conferences together, is to build some really long-lasting and dynamic conversations between a buy side and a sell side.
I love this philosophy here, and I'm sure that this has truly impacted the program that you've built here. But tell me how, for those who didn't get a chance to attend or are binge watching WTF Health videos right now, what did you bring on stage here that kind of blended those two worlds together? How did you go about that?
So in terms of content, we actually had some sessions about open innovation, hospital CIOs meet startups. We think that there's a communication gap between the two worlds that needs to be bridged. So we had an entire session about that. We had an entire track that we called, for lack of a better word, an interaction track. So that was accessible from HIMSS and Health 2.0 delegates.
Oh, nice.
And it was in one of the biggest rooms. So we really wanted to make sure that the two communities start talking to each other and working.
All right, and so how do you think it went? I mean, I know we're not done yet here, but we're close. So how do you think it went?
We're not done. We're not done
yet, but we're close.
We're close. We're close.
Are you pleased so far?
I am pleased because delegates are pleased.
Ah, good. Okay.
If you ask me, my feeling is that I'm tired.
You don't look it.
Liar. I mean, what makes me be pleased is to see the reaction of the sponsors, of the delegates, that are telling me first that it was a good idea to bring the two conferences together. I think as we move forward, we will do more events when there's some strong interactions between the two crowds.
Good. And so what can people expect in terms, like if somebody wants to come and participate and speak at one of these, what makes good content for a Health 2.0 HIMSS hybrid?
So I think it really depends. So first of all, there's a pretty big difference in terms of formats between HIMSS and Health 2.0. Health 2.0 is a showcase of the latest and greatest technologies. So what we do is we talk less about the challenges and we showcase solutions, right? And then we thread the conversation. We always invite a few experts, and then we thread the conversations around technologies that we witness. The HIMSS sessions are not so much a showcase. I mean, we've integrated a little bit of it. We've infused it. I don't know if you've noticed. We had a few sessions where we had a live demo that really could seem like you were at a Health 2.0 event.
Right.
But I think the content on the HIMSS side is really focused on the challenges and the opportunities that are lying ahead for hospital CIOs and decision makers from insurers. It's that buy side again.
Right. No, and I think that's beautifully articulated because it's not often that someone gets to see both sides of it and know it with such intimacy as you do. So thank you for that. Now, what do you have in your hand?
Oh, that's
we are clutching this magazine.
Of HIMSS Insight.
HIMSS Insights. And so this is really cool. It's like a publication that talks more about HIMSS in Europe. So very neat.
That's correct. And actually, I know this is paper.
I love it.
I'm aware of that.
I love it.
But for me, reading HIMSS Insight as a paper journal is like taking a break from work. If I read the articles online, I have the impression that this is still work. So.
I agree with you. All right, last thing for you. I know you have a pet project that you're working on right now, and so I wanted to ask you a little bit about that because it is really exciting. And for those of you who are watching and want to get engaged in the European digital health community, this might be your chance. So talk to me a little bit about what you're working on.
Yes, so we're part of a consortium for an EU-funded project called eHealth Hub. It's a little bit a continuation of the GET project, if you remember. Yeah. You interviewed me about this one. But we kind of flipped the value proposition. So the mandate, the mission is still to promote the digital health industry in Europe. But instead of asking SMEs and startups, what do you need? We're going to the demand side and asking them how can we accelerate the innovation. Tell us what you need as a demand side stakeholder.
Very cool. And so can people participate in this from elsewhere in the world, and how do they get involved?
They Google eHealth Hub, I think, and they will find our website. I think it's eHealth dash. No.
We'll Google it.
Well, we'll Google it.
We'll Google it.
But we have 7 services that are really made there to increase investment flow, accelerate the commercialization of digital health solutions, help them figure out their strategy when it comes to legal and regulatory compliance. It's a pretty,
robust.
Yes, robust and comprehensive. Yeah,
very cool.
Sure.
Well, Pascal, thank you so much for stopping by and talking to us. It's always a pleasure.
No, it's always my pleasure.
Oh my God, stop. This is Jessica DaMassa with WTF Health. Thanks so much for joining us.